today at ESC TV at ESC Congress 2023 in Amsterdam. So today we would like to talk about PROFID, which is a large international project that is funded by the European Commission within the Horizon 2020 Research and Innovations Program, which is expected to change sudden cardiac death prevention in clinical practice. So my name is Dr. Raphaela Kübeck and I'm the project director of the PROFID EHRA trial, which is a key element of this PROFID project. And I work at the Clinical Research Institute in Munich. And today with me are the two chief investigators, so Professor Dr. Gerhard Hindricks, which is the head of rhythmology and the chief integration officer
Correct.
at the German Heart Center of the Charité. And of course we also have here Dr. Nikolaos Dagres, which is the senior physician at the rhythmology department at the Heart Center in Leipzig.
So in Leipzig and very soon Berlin as well.
Yes, yes, that's true and that's right. So yeah, thank you for having you here and taking the time to talk about that project. So can you please give us a brief overview about this project, Nikos? So why is this project so important?
Yes, thank you, Raphaela. It's extremely important because the subject is extremely important. So sudden cardiac death is the #1 killer. It's leading cause of death and accounts for 20% approximately of all deaths. So it's hugely relevant and we have great difficulties to find who is at risk. So over the years, many studies attempted to look who is at risk, and these efforts were more or less not that fruitful as we could have liked to see. It's mostly after a myocardial infarction. The primary prevention is mostly done with the cardioverter defibrillator. This is a cardiac device which is very successful in terminating by the arrhythmias, but we do not know which patients really need the defibrillator. Over the years, many things have changed, but not this strategy. And this is what we want to reevaluate with the PROFID project, and particularly with the PROFID trial.
Yeah.
Actually, after 25 years of scientific silence in the field, the indications that the guidelines are currently giving are based on clinical evidence and trials that are more than 20 years old, and there's such an intense change in the quality of care over the last 20 years in cardiovascular patients after myocardial infarction that have really reset the stage. So mortality is different, sudden cardiac death rate is different, medication, intervention is different. So it's the right time for the re-evaluation of risk prediction and prevention of sudden cardiac death in post-myocardial infarction patients.
Nikos, you already mentioned that the PROFID EHRA trial is part of the PROFID project. So, Gerd, what is the current status of that trial?
Oh, we have made substantial headways, particularly over the last couple of months. The first part of the EHRA project, which was re-evaluation of existing evidences, is completed and the manuscript is underway currently. That was an analysis of 200,000 post-myocardial infarction patients adjudicated for the event of sudden cardiac death, and we made a huge, the largest evaluation on risk prediction modeling in this data set. That's completed, and the results of the re-evaluation have set the stage for the PROFID clinical trial, which was adapted according to the results. And where do we stand with that, Nikos?
We're right before the start of the trial. So we have made all necessary preparations. We have received the first positive ethics committee approval. So everything is set. The whole infrastructure is set and we're ready to go. It will be conducted in 13 countries with 180 clinical centers, and we are ready. We are hoping to get first patients in the next couple of weeks. So we are very, very close.
Okay, yeah, that's great. And Nikos, can you just briefly explain about the latest development within the trial? So the trial was formerly called PROFIT and now it's changed to PROFIT EHRA. What about that development?
Yes, this is an excellent development and we are very happy about it because it shows the great strategic cooperation and the fantastic support that we have by the association for the trial. It started as PROFIT trial. EHRA always supported the trial from the beginning, supported the PROFIT project directly from the beginning. EHRA and ESC are consortial partners in PROFIT, in the PROFIT project. But together with the EHRA leadership and the ESC leadership, we thought of ways to make this strategic cooperation, this support by EHRA even more visible. And we did this by changing the acronym of the trial to PROFIT EHRA, so it's sending a very strong signal of support across the community, and at the same time having an EHRA representative at the steering committee of the trial. And we are very, very happy that this is the current EHRA president, Professor Jose Merino, who is also our national coordinator for Spain and who strongly supported the trial from the beginning. So it's an excellent signal, and it shows also to the EP community how important this subject is and how important the trial is as itself, because we aim to set the guidelines, to define guidelines for the next years.
Actually, it's the biggest primary prevention post-myocardial infarction trial that has ever been done on the planet. It's a huge, huge project, but it's so important, it's so necessary. It will be a challenge to randomize 4,000 plus patients to defibrillator treatment plus optimal medical therapy versus optical medical therapy post-myocardial infarction, but with the help of the European community, with the help of the ESC, with the help of the European Heart Rhythm Association and their support, I'm very, very confident that we will meet this challenge.
Yeah.
It also answers a priori any questions about you want to challenge the guidelines. Is it ethically justifiable to go against the guidelines? I mean, EHRA and the ESC write the guidelines. So these are the societies that bring out the guidelines. So the participation of EHRA, the prominence of participation of EHRA sends a strong signal. We need that trial in order to write the next guidelines. We need it, we need the evidence.
So I think you quite nicely also answered the next question, which would have been from my side, why is this trial so important? So maybe you can just summarize it within one sentence as the key message. Why is this trial that important?
The trial is important, Raphaela, because currently we do not know whether or not and which patients profit from defibrillator implantation for primary prophylaxis of sudden cardiac death. And this is a relevant question for hundreds of thousands of patients in Europe and globally.
Okay, thank you. So what is the current status in clinical practice? And do you really think that the results will be generalizable of the PROFIT trial?
Absolutely. So we designed the trial so that the results should be generalizable. So what did we do? Current status is that all patients with ejection fraction below 35% after myocardial infarction receive a primary prevention ICD. Nobody knows whether whether the benefit is still there after 2 decades of fantastic advances in pharmacological therapy. So we are going to reevaluate that, and we have taken particular care with the inclusion and exclusion criteria that this study population reflects the clinical population, the patients that we see in everyday clinical practice. So we have the normal population that would otherwise get a primary prevention ICD population without any specific inclusion criteria, nothing about specific exclusion criteria. The results should define then what should go on with these patients.
So what are the next steps in the next few weeks until the next
The next steps are quite clear to us, Raphaela. It's contracting the centers that have committed themselves for participation in the PROFID EHRA trial. And we are really expecting inclusion of the first patient within the next couple of maybe 4 to 6 weeks. And then we have to accelerate. We have to communicate into the different geographies in different countries. We have to ask the physicians, the electrophysiologists for their support, for the benefit of their patients. So I believe that until the end of the year, we have the ambitious goal to get centers started in various geographies over Europe. Maybe 4 different countries in Europe should be on track in the PROFID EHRA trial.
So then I just have one last curious question, because the data analysis from within the PROFID project did not bring up this risk prediction model. What is your plan for this personalized risk prediction? Will this also be part, or can it still be part and be kept in the trial or in the whole PROFID area?
Absolutely. This is a very important question. So the initial hope, the initial ambition was to personalize the risk, and we did an extensive analysis. Gerd mentioned that over 200,000 patients, 225,000 patients, with all the different predictors that have been reported in the literature, almost everything. And what we found, and this is not considered by us to be a failure, what we found is that with these predictors it's actually unpredictable. Sudden cardiac death is unpredictable, but this is based on observational data. And the randomized trial offers a unique opportunity to test that in a randomized trial setting. And what we want to do is to include such elements. We already included them in the trial design. An AI analysis of the ECG, a promising new tool, and see whether this AI analysis can predict sudden cardiac death. And also we have 2 sub-studies, a genetic sub-study and a cardiac MR sub-study. So this is all in preparation, and we will include them in order to keep this personalized element, which is important. Not all patients are the same.
Perfect. So thank you to both of you for taking the time, being here, answering these important questions. And now if you want to participate in the PROFID trial as a participating study site, or you want to learn more about the PROFID project and the PROFID EHRA trial, feel free to visit the website, which is profid-project.eu. Thank you very much.